Hi everyone. We're going to be looking at the area of cluttering. You can find this information also in chapter 15 in your Barry Guitar Stuttering Handbook. So if we hear someone with why does everyone you know it tell me to repeat, well, repeat what I've got you just said, we might be really listening to a clutterer. Cluttering often co-occurs with stuttering. It's a disorder with probably neurological etiology, and it really isn't viewed as a problem until a child has reached school age. Many years ago, cluttering was described as a torrent of half-articulated words following each other like peas running out of a spot. So get that vision, that's by Van Riper. Sudden bursts of rapid speech that is fluent, or rather is difficult to understand and somewhat disfluent, is cluttering. It may have excess of normal disfluencies or co-occur with developmental stuttering, like I've said before. With effort and attention, the speaker may be able to speak without cluttering, and cluttering is often accompanied by disorganized language, also known as mazing, as well as learning and neuropsychological problems. So what we see in cluttering, we may have fillers, incomplete phrases, word and phrase repetitions, revisions, hesitations without tension, sudden impulsive bursts, and a message that's filled with misarticulations. What happens if a person who clutters makes an effort to control his disorder? Well, unlike people who stutter, people who clutter become more fluent, as well as slower and more intelligible when they make an effort to control their disorder. Now, this actually rarely happens, though, because the person who clutters isn't even aware that they are cluttering unless someone brings it to their attention. What else may the person who clutters have? Well, what Weiss calls a central language imbalance. There may be language learning problems. The person may seem to not get his thoughts together in a coherent, meaningful way and unable to really link sentences together. And this language is termed mazing. And mazing is a metaphor for repeated false starts, hesitations, and revisions that leave listeners puzzled about a speaker's verbal destination. So when you're listening to someone who clutters, you may be kind of scratching your head trying to figure out what are they talking about, because you're just not following the gist of their message. And it's difficult to follow. Concomitant problems of people with cluttering, they may be distractibility, hyperactivity. They may have learning difficulties, articulation problems, auditory processing problems. And I'm working with a student right now that has all of the above, where they are very distractible and can be hyperactive. They do have learning difficulties, they have articulation problems, and they have been diagnosed with auditory processing problems. And so working with them to slow down their speech, to get them to be more articulate is one of the therapeutic interventions I'm working with, and this is a junior high school student, and they are improving. The core signs or symptoms for cluttering are the rapid and the irregular speech rate that's often unintelligible and replete with non-stuttered disfluencies. The language is often disorganized. Their person who clutters does not have awareness of their difficulty. And even when a listener signals to them, gives them signs that they don't understand what the person who clutters is saying, guess what? That person who clutters doesn't even get the signs that are being given to them by the person who's listening to them. So there's also neuropsychological problems may or may not be present, and any neurophysiological basis to cluttering suggests abnormalities in the basal ganglia. And the process of evaluation of a person who may clutter, best thing to do with school-age children is to use a multidisciplinary approach, having an SLP, the classroom teacher, if there's special educator, psychologist, and audiologist. and the case history and the interview for the person who clutters, just like we have in the area of stuttering, where we want to look at that case history. We do the same for someone who clutters. When and where did the problem appear? What's the background of the individual and their family? Reasons for seeking treatment at this time, and usually the person with the clutter doesn't even know they have a problem, so they're usually not the one who goes out first to seek treatment. It's usually somebody else in their family that says, I think you might need treatment. But the idea of the person who's seeking the treatment, that's a big motivator and determiner of success in the therapy, is that client's motivation. And there may be some other problems that may be uncovered by interviewing that person. So some direct assessment of speech using an audio or video recording for about 15 to 20 minutes while the person may be speaking with a narrative about a topic that's a natural or unguarded sample, reading a passage that's appropriate for his reading level. Maybe there's a conversation where the client can talk about something that's really interesting, or maybe there's something situational and the person who clutters needs to be recorded in that setting. Again, it's that part is similar to our person who's a stutterer because we want to record them in at least two different situations. So the same might be true here for someone who clutters. And then the analysis of speech, you want to analyze the speech rate in the syllables per minute. You want to see if the client's ability to slow down his rate while speaking, because that's a really good prognostic indicator. Since for someone who does clutter, most of the therapy is to slow down the speaker's rate of speech. And we see that how frequent are these bursts, those P's going down, as Van Riper talked about. The average person usually speaks in conversation at about 6 to 7 syllables per second. So you're looking at a clutterer who would be speaking a lot faster than that. Some of the cluttering and stuttering in the speech production can occur simultaneously. One, though, usually is more dominant. Cluttering as a central language imbalance suggests that the language deficits are at its core. And again, as I mentioned, cluttering most often does occur with or co-occur with stuttering. And even though they're related, nobody has yet made a scientific conclusion of how they are related. And we see what are some of the considerations for treatment. And we know that these clients who clutter are usually not aware of their problems, and they're often surprised when listeners don't understand them. They really seek treatment. So usually they will get treatment if someone has referred them. And there are two positive prognostic signs for recovery from cluttering. And the first one is the ability to speak without cluttering if asked to do so. And the second is a specific reason for improving, such as keeping a job or receiving a promotion. And the children who clutter can often be engaged in games and activities that will create their motivation for their work in treatment. And that motivation is really what we want to see in the treatment with the person who clutters. Because if they're not understanding that they do clutter, and if they're not motivated to change, it's going to be pretty difficult to get change in their speaking behavior and speaking pattern. And last but not least, another evaluation procedure for cluttering might include Daly's predictive cluttering inventory. And that's a checklist that evaluates a client in 4 areas of pragmatics: speech motor control, language cognition, and motor coordination, like with writing problems. The ratings can help the clinician determine which cluttering characteristics are most salient and therefore the most in need of treatment. It's very useful to calculate the ratio of the number of syllables spoken and that are part of the intended message, and to analyze which are stuttered and which are cluttered. And it is a suggestion that when stuttering is mixed with cluttering, a client's cluttering may not be noticed because the stuttering is overshadowing it, and until the stuttering is substantially reduced by therapy, it may not be possible to be addressing the person's cluttering behavior. So I hope this gives you some information about cluttering and brings you up to date of all the chapters that will be appearing on the final. And on Monday, we will be going over study guide and looking at some questions that may be of interest to you when we look at the field of stuttering and we look at this aspect of another fluency disorder known as cluttering. And with that, I say good night. Have a great week. Enjoy yourselves. Take care of yourselves. And see you back on Monday night.